The growing global health threat is closely linked to social inequalities, particularly gender inequality. This was the view of speakers at the virtual Global Media Roundtable on AMR held under the theme Gender Lens and hosted by the Global AMR Media Alliance, GAMA, to mark the 2026 International Women's Day, the 70th session of the UN Convention of the Status of Women Speakers. And speakers warned that efforts to curb antimicrobial resistance, AMR, may fail unless governments tackle gender-based violence, GBV. According to the experts, a complex mix of biological, social, cultural, and economic factors arising from gender discrimination often weakens infection prevention and control efforts. They noted that harmful gender norms and stereotypes have normalized the neglect of the well-being of women and girls, making them more vulnerable to infections and drug-resistant diseases. A former Deputy Director General for Programs and Chief Scientist at the World Health Organization, Soumya Swaminathan, said reducing AMR will be difficult without confronting violence against women. Swaminathan noted sexually transmitted infections, urinary tract infections, reproductive tract infections, and pelvic inflammatory disease are often linked to sexual violence and increased antibiotic use. While Bhakti Chavan, a supervisor of extensively drug-resistant tuberculosis and member of the WHO task force of AMR supervisors, said diseases such as tuberculosis and HIV/AIDS often carry heavy stigma, particularly for women. The principal research scientist at the Indian School of Business, Deepshikha Bhattacharya, said cultural norms surrounding menstruation, caregiving roles, employment and financial control can limit women's access to clean water, sanitation, education and health. Also, as governments meet at the 70th session of the UN Commission on the Status of Women is to conclude on 19th March 2026. The Global AMR Media Alliance, GAMA, and partners are hoping for stronger decisions to advance gender equality and human rights to health, both of which they noted are fundamental human rights and critical bedrocks to advance progress on rights to health, including preventing antimicrobial resistance, AMR, with World Water Day, 22nd March, and World TB Day, 24th March, coming up. It is critical to ensure that we address gender inequalities and other access barriers people and communities face and ensure health for all is a real reality for all, where no one is left behind.